The medications used to treat men's osteoporosis can be put into two main categories. Firstly, those aimed at slowing down bone loss, and secondly, those aimed at stimulating new bone formation. Those slowing down bone loss include bisphosphonates, for example, alendronate, risedronate, and zoledronic acid. They work by inhibiting osteoclasts while preserving new bone formation. Then we've got denosumab, which is often used as an alternative to bisphosphonates. It's a monoclonal antibody and also works to decrease bone breakdown by targeting rank L and so slowing down osteoclasts. The second category are those aimed at stimulating bone formation. They're called the anabolics, and the main one being teriparatide. Less common ones include abaloparatide and romosozumab, which kind of sounds, I laugh because it sounds like a small nation from the former Soviet Union. But the anabolics all focus on promoting bone formation and are especially beneficial for men with severe osteoporosis or prior fractures. Additionally, there are things like hormonal replacement therapy with testosterone, which can help prevent bone loss in men with low or low normal testosterone levels and can even increase bone mineral density. So these are the main pharmaceutical medications used for men's osteoporosis. Each of them have specific mechanisms of action and side effects and limitations, and some make more sense in women than they do in women. So let's get into that now. But first, if we haven't met yet, my name's Dr. Tom Forfa. I'm a medical doctor from Australia, and I was diagnosed with early onset osteoporosis about 4 years ago now. And I was offered the medications by my doctors, but they didn't make sense to me in my situation and with my preferences. So instead, I used my medical knowledge and understanding of osteoporosis, and I was able to reverse it naturally without drugs. And I noticed how little there was out there for men specifically with osteoporosis. It all seems to be for women, which is understandable because it mostly affects women. But men who get it tend to have far worse outcomes worldwide. And men's osteoporosis is often very different, which I can attest to from personal experience and from my medical training. So this channel is for men with osteoporosis who want to reverse it naturally too. So hit subscribe to receive our latest videos and check out the others we've done so far. So here is what you need to know about the details of the medications used to treat men's osteoporosis. One thing to consider here is that there are some medical conditions that will complicate this and affect what type of osteoporosis medications are appropriate for you. For example, men with prostate cancer who are receiving or have received androgen deprivation therapy, men with chronic kidney disease, or long-term corticosteroid use or other medical conditions should really speak to their doctors about this. In fact, everyone listening to this who's considering the medications should speak to their doctor about what's appropriate for you. The other thing to consider is that one of the main differences between men's and women's osteoporosis is, and also its treatment, is that men experience secondary osteoporosis at much higher rates than women. I've done a video on this topic already, so check that out if you want more. But just briefly, secondary osteoporosis means that there is a specific cause, like a medical condition or a medication, that's leading to your bone loss, as opposed to primary osteoporosis, which is due to age or being postmenopause. And so primary osteoporosis is the main reason why women get it. For men, it's far more often secondary osteoporosis. So it's important for men to investigate and address any potential causes of their osteoporosis before deciding on the type of treatment. So now that's out of the way, let's start with the bisphosphonates, because they tend to be the first line treatment, and there are three of them that we're going to talk about today. The first one is the big one, alendronate. And alendronate works by slowing down bone loss and increasing bone mass by inhibiting osteoclasts. Typically, it's taken once a week as an oral tablet. There are lots of potential side effects with this one, like stomach pain, constipation, diarrhea, gas, nausea, esophagitis, esophageal ulcers, esophageal erosions, which can cause pain and difficulty swallowing, musculoskeletal pain, headache, flu-like symptoms, skin rashes, atypical femoral fractures, which is a rare but serious situation where you get fractures of the thigh bone occurring with minimal or no trauma. And there are some limitations to this medication as well. Long-term use can lead to atypical femoral fractures, as I mentioned, and also the effectiveness may diminish over time. So there's a lot there. But let's move on to the second bisphosphonate, which is risedronate. Now, it also reduces osteoclast activity and bone turnover, thereby improving bone density. It's available in daily, weekly, or monthly oral doses. Side effects are similar to alendronate. Most commonly, stomach pain, back pain, bone, joint, and muscle pain, and heartburn. The limitations is that it requires strict adherence to the dosing instructions to minimize the gastrointestinal effects, and the long-term use concerns are similar to alendronate. Then thirdly, we've got zoledronic acid. This is an intravenous bisphosphonate given once a year. So it's given as an IV infusion, usually in a clinic setting. And the side effects here, potential side effects, not everybody gets them. And they are well tolerated, these medications, but the side effects can be, people get very concerned about them. So things like for zoledronic acid, it's things like flu-like symptoms, gastrointestinal issues, headaches, fatigue, bone, joint, and muscle pains, renal impairment, and osteonecrosis of the jaw, which is a scary but rare side effect. So limitations, it may not be suitable for men with renal impairment, and annual dosing requires a visit to the clinic. So an alternative to bisphosphonates as a first-line treatment is denosumab. And denosumab is a monoclonal antibody that inhibits RANKL, a protein essential for the formation and function of osteoclasts. And it's given as a subcutaneous injection every 6 months. Potential side effects here are skin infections, back pain, joint pain, skin rashes, fatigue, upper respiratory infections, and also osteonecrosis of the jaw. Limitations is that it requires ongoing administration to maintain effects, because discontinuation can lead to rapid bone loss, which could be a problem. Now let's move on to what's commonly referred to as the second line treatments, the anabolics. And as we mentioned earlier, the anabolic treatments focus on stimulating new bone formation rather than just preventing bone loss. Now, these treatments are particularly effective in men with severe osteoporosis or those who have experienced fractures. The first one is teriparatide. It's a form of parathyroid hormone, and the way that it's given stimulates bone formation by activating osteoblasts, the cells that are responsible for building bone. It's a daily subcutaneous injection, typically for a maximum of 2 years. And common side effects include nausea, leg cramps, dizziness, pain in joints and muscles, headaches, injection site reactions, and hypercalcemia. The limitations to this one is the cost. It's quite expensive. That's why it's used as a second-line treatment. And it's limited to only 2 years of use due to cancer risk concerns. The second anabolic is the alabaloparatide. Now, some of these names can be challenging to pronounce, but yeah, alabaloparatide. It's also an analog of PTH-related protein that enhances bone formation. Again, this is a daily subcutaneous injection for up to 2 years, so it's very similar to the previous one. Side effects are similar as well, with most common ones being hypercalcemia, dizziness, and injection site reactions. The limitations, again, similar to teriparatide, limited to 2 years of use and the high cost. Now the third one is the one with the funny name, romosozumab, and this is a monoclonal antibody that increases bone formation and decreases bone resorption by inhibiting something called sclerostin, which is a protein that regulates bone metabolism. And this one's administered as a monthly subcutaneous injection for 12 months. So shorter period of time and less frequent. The potential side effects, joint pain, headaches, injection site reactions, hypocalcemia, muscle pain, increased risk of heart attack or stroke, hypersensitivity reactions, and back pain. The limitations of this one is that it's restricted to 12 months of use. There is a potential for cardiovascular risks, which limits the use of it by patients who have a history of heart disease. So these are the osteoporosis-specific medications. However, since one of the major causes of osteoporosis in men can be low testosterone levels, what has shown positive results in a number of studies is hormone replacement therapy in the form of testosterone replacement. Now, I've done another video on how low testosterone is connected to osteoporosis in men, so check that out if you'd like more details. But briefly, talking about testosterone replacement therapy for osteoporosis, the way it works is by increasing testosterone levels, which prevents bone loss in men with low levels already. And it comes in various forms, including gels, patches, and injections. Side effects potentially could be prostate issues, cardiovascular risks, and potential impact on red blood cell count. But it tends to have very positive effects on men who have low testosterone, so it might be worth looking into if that's you. Limitations, it requires regular monitoring of prostate health, if you know what I mean, and cardiovascular status. So there's a lot there, a lot to consider, and you should speak to your doctor about what's best in your situation. I'm not anti-medications, I'm not pro-medications. They just need to make sense and be right for you. And they can really help you get into a safe T-score zone and Z-score zone quite quickly. But there is a lot that can be done without them and also alongside of these medications. So a lot to consider there. But if you'd like more videos on men's osteoporosis, hit the subscribe button and the bell notification to get notified when the next one is released.